Hi, I'm Jeremy Crosby.
And I'm Nick Boucher. We're your hosts for the program that's all about your city, Talking Fitchburg.
Every weekday, we pull together the news, events, and information you need to stay on top of what's happening in the city of Fitchburg.
Find Talking Fitchburg on cable TV, Roku, Amazon Fire, Apple TV, and our live stream on the web. Plus, you can find all our headlines and stories on Facebook, YouTube, and our video on demand service. This is your city.
Keep up with Talking Fitchburg and the issues affecting you and your neighbors.
Want to know what's happening in your city? Get Notify Me messages from the City of Fitchburg. Visit fitchburgwi.gov on your computer or mobile device and select the big Notify Me button on the left. Enter your email and/or phone number, whichever is best for you to get notifications. Scroll down the list and select all the topics you're interested in to receive email or text messages about. You'll be notified every time one of your topics is updated. Sign up for Notify Me, one more way to keep up with your Fitchburg government.
Call to order the meeting of the Fitch-Rona EMS District for Thursday, August 21st, 2025. Roll call. I guess we don't have, Michelle's not here.
Nope, Michelle wasn't able to make it tonight. I've got that. So James Roberts.
Here.
Nicole Vafadari. Jake Lepper.
Here.
Perfect. Derek Johnson is excused. Patrick Lytle.
Here.
Stephen Fusco.
Here.
Dave Lonsdorf.
Here.
Deb Paul. Sue Lugenbuhl and was going to be absent. I am here. Chief Dostalik. And I know Chief Anders is not attending. So we do have 5 of 9. We do have a quorum.
We have a quorum, okay. Thank you. And public comment, I don't see anyone from the public here.
Nope.
So
I got nothing.
No public comment, all right. Swearing in of paramedic Jessica Peters.
Okay. So I'd like to introduce our new paramedic. She goes by Jessie, or as Jessica Peters. So Dale has retired officially. He's got 1 more week. He'll be off of our roster next week, officially retired. But Jessie was hired to fill his spot. So we will do her swearing in for us. So I'll have you raise your right hand. Please repeat after me. I state your name.
I, Jessica Peters,
As a sworn paramedic of the Fitch-Rona EMS District, swear that I will faithfully, honestly, and impartially
as a sworn paramedic of the Fitch-Rona EMS District, swear that I will faithfully, honestly, and impartially
discharge the duties of an EMS provider,
discharge the duties of an EMS provider,
and I pledge to carry out these duties to the best of my ability.
and I pledge to carry out these duties to the best of my ability.
I recognize the badge of my position as a symbol of public faith and trust,
I recognize the badge of my position as a symbol of public faith and trust,
and I accept this position so long as I am true to the ethics of the emergency medical services profession,
and I accept this position so long as I am true to the ethics of the emergency medical services profession.
I make these promises solemnly, freely, and upon my honor.
I make these promises solemnly, freely, and upon my honor. I think he's good.
He's got it. Like after all that, where did it go?
Yeah.
I'll present you with your patches.
Thank you.
Congratulations.
Thank you so much.
Yay. Let's do a quick picture.
Welcome to the Fitch-Rona EMS Commission.
Yeah. So hopefully Jess will stay as long as Dale did on the force. Was it 27 years? Huh? All right, let's review and approve the meeting minutes from July 17th, 2025. Where are they here? Right there. Has anybody got any corrections or comments on them? All right, I don't see any. I'll accept the motion to approve.
I'll make a motion to approve.
Second. I wasn't there either. So Patrick, were you there?
If we get this solved, it's a really big day.
No. Jake, were you present? Let's see.
Yeah, I can second. If that's
Yeah.
what you need.
All right. So Jake will second them. We'll vote on them. All in favor, say aye. Aye.
Aye.
Any opposed? All right. Minutes pass. Next is Chief's report.
All right, thank you. As this was mailed out to you, like always point out to you, right, it was another busy month in July. Tracking 11% overall increase in call volume for 2025 as we're this far through the year. Other numbers in there are pretty par for where they have been in the past. Still always like to point out the mutual aid calls required to date jumped by about 8 calls. As we had a busy month last night, as we had a busy month last month, we also had a couple of those days that were very, very busy days and required a significant amount of mutual aid. So we're at 45 total last year. We're already at 35 times this year. Where City Madison, Middleton, Oregon, or Mount Horeb had to actually come in and help us out. So as we look to increase our staffing, it's always a number that I like to point out to you. Lots of community events, always really busy during the summer. So shout out to those people for working, lots of great feedback for working with those community groups. Aging is pretty par for where we are at. Cash on hand, you can see there we have gotten all of our funds posted from the municipalities, so that's why it's high. So we've got our second half of the year payments from the cities. Really, the only other notable expenditures is from a couple of months ago when we made moved the funds in the unassigned fund balance, and we raised that unassigned fund balance to try to watch for 35% instead of the 25% that we normally have, as well as putting an additional, I think it was $180,000 into the post-retirement healthcare. So those funds have been deposited. That's why you see the significant increase in the WISC investments, and I broke it out a little bit different. The two HRAs, that's the health retirement account, so that's the post-retirement healthcare account. There's a little bit different in money market and CDs and investments. That's why there's two cash management and investments. Our essentially financial advisor at WISC moves those funds back and forth, or consulting with us to get us the best return on interest in between the two of those, and then the unassigned fund balance. What we did is to try to keep that up to that 35%. We currently are getting a better return on our investment through WISC. So we put a big, large unassigned fund balance in the WISC account. So that is just truly an unassigned fund balance sitting there where normally it would just be sitting in our money market here at Oak Bank. So that's why you see kind of that $421,000 increase in the WISC funds. Those are the two, the unassigned fund balance and the health investments, or health retirement. Only milestone we had in August was for Carlos, who's one of our LTEs, a full-timer out in Sun Prairie, so it's 3 years with us. Quiet month for shout-outs. I think everybody was just really busy. The only other updates I have written down is the IGA was approved, I want to say last week at the Fitchburg City Council, so actually all 3 municipalities have now approved it. I don't have the signed copies yet. Talking with Jamie from the city of Verona today. He's working on getting it routed. I believe they've got 2 of the 3 signatures on it, and then he will get that copy to me. I will share that copy with you. We'll get it up onto our website. But the IGA has been approved effective January 1 of 2026. So things we've talked about in there, it has changed the funding model that we've seen for the 2026 budget. And then as I've shared with you in the past, it will change the governance of the commission starting in January. So there'll be some adjustments with seats. But that has approved. We had I want to say it was our 3rd contract negotiation meeting today, just to give you an update on that. We're close. We're still just close. So we will be working on scheduling one more meeting with that group. Shared with you, Jessie, we met her tonight. She's our brand new hire that took Dale's position. She will start. It's kind of a first for us. This is the first time, at least since I've been here, we've not hired or promoted, I guess, from our LTE pool. Jessie was an LT with us previously. Left for a different position. So she actually will have a couple of days of onboarding before she comes to us for full time. So she'll start next week with about 4 days of onboarding as opposed to just us, I want to say, throwing her to the wolves, but just right. Our LTs usually come with a handful of experience. It's just, they're just starting to work more hours as a full timer now. So Jessie's in a little bit of a different position. So we'll get her onboarded, make sure that she's doing well, and then we'll start September 2nd, I think, is going to be her first shift out of Station 2. And then just always love to share the oxygen generator that we spent a lot of money on and is hopefully going to save us a lot of money in the future. It is delivered. It is installed. We're just waiting on the training, which has been a little bit of a process. So that is actually scheduled for next week, Wednesday, Thursday, Friday. It's an on-site training. They come, they set it up, they make sure that it's doing what it's supposed to be doing. They'll train us on it. I don't want to say, it seems oversimplified to say it's really plug and play, but it's kind of plug and play. But then they will walk us through essentially the maintenance and what if something goes wrong. So we'll be up with that and very self-dependent here in the very near future. That's all I have for my chief's report. Pending any questions.
Okay, looks like no questions. We'll go on to the accounts payable for the checks. There's 5 pages. Any questions about them or comments from anyone? All right. Do we approve the checks or? All right. Motion to approve.
I make a motion to approve the checks.
All right. Second.
I'll second.
All right. Any further discussion? All in favor, say aye.
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 Any opposed?
Aye.
Oops. There we go. An aye. That's an aye in favor. Jake?
Yes. Sorry.
Yeah. Okay. All right.
It's the delay from the
You
other
got
side
the
of
delay.
Fitchburg. Yeah.
All right. Okay. So all in favor, no opposed. It passes. Next is Resolution 2025-6, approval of the GASB 54.
Yep, I talk about it every month. So this is the required by the accounting system. It's just designating funds that are sitting in our budget that do have or are the wealth of Fitch-Rona that are assigned somewhere else. Right, the non-spendable money that we have for inventory, the non-spendable money of prepaid expenses, those do not change every month. What we do see changes every month is the sick leave liability that as I showed you, is $470,000 after we put that additional funding in there. So we have a very well-funded now post-retirement health care, as which is Dale. So I did keep out a handful of funds. Dale will be retiring officially as of next week, and then he will actually get his pot paid out. So though we approved, I think it was the $180,000 to go in there, I did hold, I think it was about $45,000 out of there that we will be paying out of that fund as opposed to putting it in and pulling it out 2 weeks later. And then we have probably about at least 2 more people, if not 3 more people, in the next 2 years will be retiring as well. So we're going to see that funds go down. And then the last one, the legal fees for contract negotiations. If you remember, that's just funds we put in there on the off chance we have to go to mediation or arbitration, which can get fairly expensive. We do take the hourly rate out of there as well, based on we haven't got it. We've got our first bill for contract negotiations, but it didn't come in until August. This is only through the end of July, so that's why we haven't seen any funds come out of there yet. But that's what those are for.
All right, any questions? I guess we need to approve that. Motion to approve.
I'll ask a question quick. I'm unsure how far back we have to work with fund balance, but it references May 2025. Okay, sorry.
It's wrong.
So I would make a motion to approve the resolution with a change in that last paragraph. It's August 2025 general fund balance.
All right, thank you. That's a good catch.
I'll second.
All right, any further discussion? All in favor, say aye.
Aye.
Aye in favor.
All right. Thank you, Jake. And any opposed? All right, motion passes. Next, we got several policies. Chief, do you want to just walk us through these?
Sure. So I'll just do the quick overview of our policy on policies, right, how that process is. Any policy changes do need to be brought in front of the commission for review and approval. We have in the past brought it up to subcommittees and then brought it up to the group. The interest of time, and I don't think these are too super controversial. I'm just going to bring it to the whole group as a whole. We can discuss it. We can approve it. You can send it back to myself and essentially Jeff and Devin, who can work through it again and bring it back to you. But if you approve it, it actually then gets sent out to the union for input. They actually have a 21-day input period. Any comments, concerns, questions they have can be brought to me. I can bring it back to this group and you can consider them if you want to change it or not, or you cannot consider them and we move. Otherwise, after 21 days, it does get approved. So that's the process of how the policy works. That's why you're looking at these. For the first one on there, that's the employee injury reporting. As I was going to share, this is actually an easy one. So I did email out you got 2 copies of them, and they were posted online as well for anybody who's looking. Anything that starts with VARKO, VARKKO, that's actually the policy as it exists today. And then you got the attached draft policy. The employee injury reporting was actually a complete rewrite of the policy to really update the information in there. So that's why you got the 2 different copies. My request on the employee injury reporting is actually going to fairly simple and actually ask that you make this not a policy anymore, but make it actually a procedure. Procedures, right? SOPs or SOGs are standard operating procedures and guidelines. They're really just a lot of the how-to things. So our current workers' comp carrier now actually has essentially a nurse on call thing. So if someone is injured at work, clearly if it's an emergency, they go to an emergency, but otherwise they call that number. They start the workers' comp process. So to do that, we have to change, essentially it's a procedure. So I think a policy is probably a little bit more rigid. The policies then we can change, the procedures we can change without having to bring it to this board, because I'm pretty sure you don't care how we do employee reportings of injury as long as we do it, do it correctly. I can walk through the process with you. You have the process with you, but what I would look for would be a motion, if you're okay with that we actually remove this from our policies and make it a standard operating procedure.
I just have a question. How do you define an injury? Is that just up to the individual injured, like a stubbed toe, they forget about it, but blood coming from something?
If they feel they stubbed their toe and it was related to something they did at work and want to report it, they can report it.
They do. Okay.
We ask that any sort of injury is reported, whether they go to the hospital or whether they get seen at urgent care or not. It's just reported. It doesn't really hurt our workers' comp premiums unless they're on lost time. So if somebody's like, oh, I hurt my finger, they just report it, and it gets generated in the workers' comp log, and that's it. So, and that kind of allows, if something were to happen in the future, like I injure my back and they don't report it, how did you injure your back? Well, I injured your back 3 months ago, but you didn't tell us 3 months ago. So we just try to get all of that stuff on record right away.
Okay.
We have a very good workers' comp program. I think our experience mod is, it's like 0.7, which is, 1 is even, and we're 30% less than that because we don't have a lot of lost time. So,
good.
Yeah.
Are there any like OSHA reporting standards that you're held to as well? And is this any different than that?
I think the answer is no.
I think because we're sort of a municipal agency, we don't really fall under the OSHA guidelines. However, we follow the OSHA guidelines in reporting.
Cool. Thanks.
Patrick.
Just clarification on, is this a process that we've already started in terms of having the on-call nurse, or will the staff get trained on the new procedure after this gets, this replaces, staff already know that there is this on-call nurse available to them?
We've already trained the staff on it.
Perfect. Yeah, no, I mean, this, just data point, this is how our company has shifted to having that on-call nurse as opposed to sending people to urgent care for everything to document it. This is honestly faster and does have some benefits for the organization as well. So
this was a recommendation from our insurance company, and if the employee wants to be seen, they can be seen. But when they call, and we've had a couple of cases already, when they call the on-call nurse, the on-call nurse, MedCore is who it is, can direct the employee to the urgent care centers, which we've listed, and our crews are aware of where those are at. Outside of the urgent care times, then they can go to the emergency room. And they fill out the whole workers' comp form for us, the first notice of injury. And so and they get a case number, so if the employee has to be seen 2 days later, they just call the on-call nurse and then give them the case number, and it's automatically put into that file.
Great, thank you.
Thanks.
Yeah, sounds like a good system. More comments? All right, motion to, let's see, we want to change this from a policy to a standard operating procedure.
Yes.
This is the employee injury one?
Yes.
Yeah.
Okay. I'll make a motion to do the employee injury policy and make it a procedure.
Okay. Second?
I second.
Okay, we got motion second. Further discussion? All in favor, say aye.
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 All right, any opposed? Good, that passes. So now you got a new procedure. Yeah. All right, ambulance accident reporting policy.
Sure, and I again apologize for that. You compare and contrast the two of them and not seeing the red line version of it. But I'll point out what the major differences is. A lot of this was changed into formatting and providing a little bit more guidance for our crew. So really, oops, that was really big. One of the challenges we have had is essentially defining that this policy and the drug and alcohol testing policy were kind of developed probably about over the last year, and it's been done in conjunction with the union. So at least the union, our leadership, our union team that we work with has seen this, and we've worked through some of it. So part of the starting with the challenges of truly defining what a reportable accident is. So we're trying to provide them with more guidance. Biggest change in this one is the second bullet point here, and the formatting doesn't quite match what our current policies are, so we'll make them match. But the biggest thing here is essentially what we are telling our crews is all accidents, regardless of severity, must be reported to the police. So there is actually some state statutes, some administrative rules that do specifically apply to municipal or state-owned vehicles. Clearly the ones, right, death or injury of somebody involved, citations have been issued. The sticky spot gets to be, I think, $1,000 in damage to a private vehicle or $500 in damage to a municipal vehicle. There's some language in there I think our argument to that is that if anybody's ever had a driver's side mirror replaced in your car, it's like $600, right? So to only have $500 in damage is pretty minimal. We have had a small, I believe it was reported as a love tap at an intersection, right, that turned into thousands of dollars in damage to the vehicle we did the love tap to. That wasn't reported, right, because at the time they felt there was not enough damage. So what this does is essentially all incidents should be reported to the police. I mean, it does allow in there if the police are busy, if you've ever had an accident or been involved on any of those days where the roads are nothing but glare ice, right? You do give a tap to somebody and the police are saying we're only responding if somebody's injured, you need to self-report it. They can self-report it, but basically by calling law enforcement, they have complied with the policy that says we called and this is what we were directed to do. They're also given, we have the cheat sheets in the ambulance about any accident, right? What they should and shouldn't do, right? Recording, getting names of witnesses. We do carry insurance as we're supposed to in all of our ambulances. In the back of there is a cheat sheet that says get all of the following information. We do have an accident form that we'll just continue to update. The guidance about don't talk specifics, don't argue, right? Be responsible. Contact one of us, whoever that OIC is, immediately and need to fill out an accident report form. Then we submit that to our insurance company. We did put in there the admin deputy chief. That's largely Jeff's job to manage all of those. We just left it deputy chief or the admin deputy chief. So when Jeff retires in 2.5 years or 5 years, whatever, or sooner, whenever it is, we don't have to come back and change policy again because Jeff retired. So that's what we put it in there. And then it moves on to the drug testing policy from here. So I said that the two kind of go a little bit of hand in hand because in order for us to get to the drug testing policy, we actually tried to define what an accident was. So that's really what updated. This is defining truly by state statute what an accident was, and what we are saying is any time you were involved in an accident, right, then that should be reported to the police. I can bring up the original policy says a lot of, you can see it misses quite, it essentially says report it, fill it out. We don't even have a Dane County EMS automobile accident form anymore, right? So the old procedure was actually fairly outdated. Any questions, comments?
So I have one. I can see if the ambulance has dropped their person off at the hospital and they're on their way back, they have an accident, they can stop and do all this stuff. What if they're picking somebody up or on the way to the hospital? They don't have time to stop.
Yep. So that's what that paragraph says right there. If the accident occurs during patient transport, the crew should make the decision to continue the transport. If it's safe to do so, contact the communications center if an ambulance needs to be dispatched to continue patient care. Okay. If the transport is continued, the appropriate law enforcement agency must be notified of the accident as soon as operationally possible. It has, so, if we are truly driving lights and sirens, and I think we tapped a dump truck on University Avenue when it was down to half of a lane there, and we were emergently driving through there. Clearly we didn't damage the dump truck at all, right? It won that battle. But they were transporting a patient. They went to UW Hospital. They called me and said, well, we wanted you to know that our dump truck's not damaged, but we do want to acknowledge that you tapped us. So they finished the transport. They did reach out to law enforcement or called us after the fact when they turned over that patient care, and now it was safe to do so. So that's the guidance we have provided to them, right? Acknowledge so it doesn't look like you're leaving the scene of an accident, right? It's acknowledging what you did. They can call them on the radio even, while they're transporting and say, this is what happened, but we're transporting. Please, when they call, let them know to meet us at XYZ Hospital.
Yes, sir. All right, other questions, comments? All right, this one we're going to approve as a policy revision. So I'll take a motion to approve this.
I move to approve the policy revision.
All right.
I'll second.
Second. Any further discussion? All in favor say aye.
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 Any opposed? All right, we're good. Last one, the drug and alcohol policy.
All right, so you'll see that one in front of you as well. This one I was able to do a much better job of the red line revision, and we're starting to get back on top of doing at least an annual review of policies and bringing them back to this body if they need to be updated. We're also trying to do this as we found out lots of these are very connected to make sure that we change one and we're making sure that the language is correct in a different one. So we're also adding, right, also referenced in drug testing policy. So some of this is changing grammar. One of the concerns that did come up is how the original policy was written, right, was that you're advised that you cannot knowingly use, possess, conceal, promote the sale of controlled substances on or all district properties and in district vehicles. Well, we carry controlled substances in our vehicles, right? So per letter of the policy, they were already violating it every day they were in the ambulance. So I'm like, okay, acknowledging it. So outside the duties of an EMS provider, there's 4 controlled substances we do allow in the ambulance. We carry those there in the course of our duties. This one is a little bit of a sticky point. We can debate it as long as we have been debating it amongst ourselves and with our union or crew. Defining essentially prohibited illegal drugs and substances, and one of those is drugs not legally obtainable in the state of Wisconsin. We'll see in here later, there's the process of drug, there's a couple different reasons we can do drug testing for employees. One of those is called reasonable suspicion. And our own policy said, supervisors will be trained in reasonable suspicion. I can tell you none of us had been trained in reasonable suspicion. So it was a good thing it came up. Devin and I have gone to the class. Jeff is still waiting to get into the class. But so I actually did work with the owner of the company who we took the reasonable suspicion training through, who does DOT drug testing. So she took a look at this and actually did recommend the added in the state of Wisconsin. As you can imagine, and I think as we have talked about this before, marijuana is the big one, right? It is legal in 2 states surrounding the state of Wisconsin. It is illegal in the state of Wisconsin. So kind of the crux, right? I can go to Illinois where it is legal to buy and obtain, but hence you can't carry it across the state lines and have it in the state of Wisconsin. So right now we're looking at, though we are not, you're back to your regulations, we are not regulated by DOT. It does not require a commercial driver's license, CDL, to drive an ambulance or a fire truck. So though we are not regulated by DOT, we do or can follow DOT guidelines, which are pretty clear. And one of those is you cannot have illegal drugs not available in the state of Wisconsin. One of the other questions was, one of the things we talk about is performing safety-sensitive functions. Question was, well, what is a safety-sensitive function? So we put in there, right, it includes but not limited to essentially the big things we do, and that's providing patient care directly or as part of a crew and operating a vehicle, right, the big things that are on there. One of the questions that came up regarding this sentence here is, right, so if I am the driver of the ambulance involved in an accident, historically, and even in this case, we would just test the driver because the driver was involved in the accident, but we have included in here providing patient care. The policy as a whole addresses employees who are on duty. So but if I just put the driver in there, that means because I'm not going to drive today, that means I can be under the influence, right? Well, that's not the case, clearly, right? So it does address both of those. neither one of those positions performing a safety-sensitive function, you have to be in compliance with the policy. We did kind of, language was about it being impaired. It kind of went back to our use of THC, kind of just putting in there not that you're under the influence, but that you're also impaired. Talked about, right, there's 4 different reasons, or I guess 5 different reasons we can actually test employees. We do pre-employment testing. Here's the post-accident. We just clarified that post-accident policy, the reasonable suspicion training, returning to duty, and follow-up testing of applicants as part of that process of drug testing. Right, we did not change the pre-employment testing. We'll still test for it. We did not change the timeline required, or these are actually following the DOT guidelines about when you test post-accident. Right, defines who gets tested, the employee performing the safety-sensitive function with respect to the vehicle involved in the accident. So we removed this. It has now some conflicting language based on the revision of the accident policy. It previously said the accident involved loss of human life, serious fault or property damage. So we've removed all of that and said all accidents are reportable. We kind of unclarified it in this policy. Just said if you have an accident as defined in the previous policy, you may be tested. Clearly, if you get a citation, you'll be tested. What do we do with the employees? Right, they'll be assigned to a non-safety sensitive function or placed on paid administrative leave while awaiting the results. The results are actually fairly quick. If I remember right, the 24/7, they will come. Depending on the time of the day or day of the week, they will come to us and actually do that testing. And I think it's within 2 hours. Yeah. If during the day, Monday through Friday, we can actually, I think their offices are in Monona, right? It's not something if I have somebody who I believe is impaired, I'm going to go say, drive over to Monona and get tested, right? We're not going to do that. They can come to us and do the testing. We can take them as a supervisor. And there's some criteria for the testing agency, right? That a supervisor must accompany them in certain situations. But they are placed, essentially, we pull them off the ambulance. We don't let them continue to operate if we have any sort of reasonable suspicion, as the language says, that they are impaired. And just added language in here. This is straight out of, I think I put a note over here. This is straight out of the DOT guidelines about reasonable suspicion, right? What qualifies for reasonable suspicion. We do actually, and it was shared with the union, there is a guideline, there is a check sheet that is filled out that says on this date and time, Patrick observed the following things, right, that are listed in the sheet that may be listing, maybe guiding me to reasonable suspicion that there's somebody who's under the influence. Now we do joke, right? It's messy hair, crabby, tired, like the 2 a.m. call, right? We do, but clearly there are some guidelines there. Switching again from use to impairment. How the process works, and we just did this, so I even had to learn a little bit about this myself. So the testing company that we use, whatever they test, whether it be blood or breath or urine or hair, those results are actually sent to a designated medical review officer for that company. So we don't even see, essentially I'll call them the raw results. Those results are sent to that medical officer to review, who only provides us with a positive or negative. If it comes back, again, those raw results that I don't see positive, that medical review officer does reach out to the employee. I will give you the example, right? We are finding a low dose narcotics in your system. Is there a reason you're on these narcotics? Right? The employee just says, yes, I have a back injury, right? I'm on low dose hydrocodone, kind of back reflecting to the impaired versus actually having, right? Why do you have opioids in your system? I have a prescription. It's right here from my doctor for back pain, but I was not impaired at the time. Then the MRO actually only reports to us that there was a negative result. So we don't get a positive result with an answer. We just get something from the MRO that says there's a negative result. So it is reviewed. If we move they don't have the right to refuse. Well, it says they have the right to refuse testing. If they do come back positive, this is just right how we do it. If they do come back positive, it's in here somewhere. There is a process in place with the MRO to determine. I'm sorry, I went really fast. Right here. So here's like the results. So the employees, and this is actually because it's a public sector employee thing, right? Employees don't have the right to refuse to submit to tests. If they do, right, they enter disciplinary action. No, it's not it either. Refusal of testing. Oh, sorry. Look, I got it on paper. There's a process in here. Sorry. Procedures. Here. So the employees are not automatically, right? If I do get a positive result back, the employees are not automatically terminated, right? They enter what, by lack of a better term, the disciplinary process. So there is an option here, right, to work with employees to get them the information they need to get them counseling, and they work with the MRO on that. So they're encouraged to seek assistance, right? So there is employees are not, they may be, but they are not automatically terminated should that result come back positive. Essentially, it enters the disciplinary process to determine what the extent of the problem is. The policy does allow right for counseling, restricted duties, that kind of those options. That's the policy update.
The testing is, say they've got a prescription, will that test reflect whether they're following the amount or whether they're using 3 times the amount, where it maybe should be positive versus negative?
The MRO determines that. So there's a physician who determines all of that. So we are not, right, that's not up for Patrick to determine, that's for a physician to determine. And it says in here, and it comes straight from the place where we do the testing, the physicians, and it's not, right, it's not Patrick's dermatologist who's determining this. They're actually, it says, trained and certified through the Department of Transportation on how actually to read and manage drug testing.
So there's a way to tell whether they've taken too much?
Well, this question came up for us as well, as we were specifically talking about THC, of levels of THC, or is it just positive or negative, or is it how much did you take?
I mean, alcohol, you got the BAC.
Right.
I assume.
Yeah.
Blood tests can show whether they're.
Yeah. These are all questions I do not know. And here it actually said the substance abuse professional. So they are required to go see counseling, and that person determines what is required. They undergo evaluation, and where necessary, rehabilitation. They follow a substance abuse professional who then they determine whether they have successfully completed the rehabilitation or not. The answer to your question, I don't know. It's trusting that there is an MRO trained in substance that should be able to tell us whether there's concern here or not. I don't know if you can provide any more guidance to that. Or
I mean, generally, the level of a drug in your system doesn't correlate really well with how impaired you are. So if you're on an opioid and taking it chronically, you can tolerate much higher doses of it than someone who's never taken it before. And so for a person who's newly taking it, a low level may impair them. For a person who's been on it for 3 years, a higher level you won't even notice it. It won't impair them. So I think the tests are just positive or negative. I don't know how the medical officer decides whether they're impaired or not. They don't. Or they just, yeah.
They just report a positive or negative results
Yeah.
to us.
I mean, it's sort of the same thing with blood alcohol level. Someone who's never drunk before could be very impaired with a couple of drinks, whereas someone who drinks all the time could drink 6 drinks and not be that visibly impaired. Yeah. So.
I guess I'm more curious. Certainly don't feel qualified to wordsmith any of this, but you mentioned some of the input to the revised policy came from the reasonable, the firm you're using to
Drug and alcohol testing. Yeah.
Mm-hmm. And is this a policy that should have been reviewed by the district's legal counsel? Is this something that we've modeled after other emergency services providers' policies to make sure before this gets instituted that it would stand up to a potential action from the union or
Sure.
another some kind of lawyer?
Well, it's probably not a bad idea to have the attorney look at it. I think what we found is that there's not a lot of policies out there like this. So, we could call 15 different EMS agencies in Dane County, and somebody's going to say we don't really have a reasonable suspicion testing policy. I don't know what we would do. And that's what we found when we started looking at this, is there were agencies out there, bigger agencies than us, that went like, not really sure what would happen. So I kind of feel we've really setting the standard for what should happen. And by no means is this to try and get an employee to test positive and try to catch them doing something. We have great employees, but we all know that if something does happen and, we have a really bad crash and we don't have something in place, then Channel 3 is going to be sitting at our door asking us questions. And so really this is just a way to get us some guidance, and we're probably setting the standard, I would think, or close to it.
We can absolutely send it to counsel, to our legal attorney. I think we had a place we're going to send. Our insurance company also does policy review.
Yeah, we can send it to EMSMC.
Yeah, so we can send it to.
That's a good idea.
And I don't want to not have an improved policy in place in the meantime. I just think this is important and potentially could expose the district to some sort of legal challenges that having someone with a little more experience would be helpful.
Yeah, absolutely. We've been kicking this around. I don't want to say it's been a year, but it probably has been about a year.
The fortunate thing that our billing company, EMSMC, has a relationship with Page, Wolfberg, and Worth, which is a large EMS law firm. They write policies. They are the standard in the country, and we can send this policy through EMSMC to their attorneys there and their compliance officers, and they can look at it and see kind of what recommendations. If we were to have to take somebody to court because of this, they probably would need an attorney that would come and either represent us or the employee. So they're experts in this field. So it's probably not a bad idea to at least start there. And they'll review the policy for free.
Yeah, just kind of jumping off of that, I'm curious a little bit more about the reasonable suspicion training. Is this required of supervisors?
It's in our policy that,
Okay.
and once we went through that training, and once we kind of realized we were lacking in it, we actually did add it to the job description for our chief level, for DOT, for DOT or anybody who's got like a CDL. So actually the director for Public Works for the city of Fitchburg was in our class with us because he was like, I've never been through this training. So like Public Works drivers who all have CDLs, their supervisors all are required to take reasonable suspicion training. It's a DOT standard.
It's 24/7 is the company out of Monona, and they don't offer it very often. I think they had one class this year, and unfortunately I was on vacation then the day those two went. So as soon as they have another one, make sure we get in.
Last question I'll ask. If this is a district policy, does it apply to you all as well? Absolutely. Thank you.
Yes, and that's where when we go back to the reference in there, that references driving the ambulances way up top. And non-ambulances. So it applies to every vehicle. Yes, it does. So yes, we have to police each other. So I mean, I will put it back to your comfort level. We have a policy in place, right? We're just trying to make the policy we have better. So if you would prefer to wait, and I can bring this back next month after we send it off for review we'll kind of figure out the best place to send it, if not into multiple places, and we can bring it back next month as well, if you would like, or if you want to approve it as is.
All right. I assume as new policies get implemented, staff have to sign off that they've seen it and reviewed it. So probably waiting a month and not having them go through it twice. And again, this will go through the union review anyway, right?
Yep.
So my preference would be to do it once with that extra level of scrutiny. But if you guys have a reason why you'd really like to have it in place and then potentially revised, I wouldn't be against that.
We were just done massaging it for the last year.
And a lot of the revisions have gone through the union as well. They've had a lot of input into this. There's been lots of discussions about this policy with them. So it's not anything that's going to be new to them. It's just going to be once it's implemented, then they have to sign off on it. And so I would say that's probably a reasonable thing to do.
Yeah, really, it's for their benefit as much as anybody's. If you're riding in the ambulance with somebody who's driving it in an impaired condition, you're not safe either. Mm-hmm. Yeah. Well, I think that sounds like a good idea. I would support getting the MC lawyer if it's free and they're expert. Yeah. Just because drug testing and even the reasonable suspicion stuff, I'm sure the class is good, but it's still it's very hard to tell what impairment is with people. Everybody acts differently and has different levels of tolerance and all that kind of stuff. I'm sure you found that out in the class. And so the more this gets reviewed and sort of looks like a well put together policy, the more it's going to stand up in court if it ever has to. So.
For what it's worth, the state statutes when it comes to like impaired driving set two different standards. So there's the legal limit for alcohol, and then there's just the mere fact of having a controlled substance in your blood, and then there's the tests that police officers do to determine impairment. So to a certain extent, from that side of the law, it's just a strict liability if your blood alcohol is above a certain level, or if you have a controlled substance in your blood, then you're held responsible for it. Obviously, that's specific to driving, but it's worth just mentioning.
Yeah, no, appreciate it. I suppose we can just send it to you to have you take a look at it. I didn't hear any volunteers in there. Yeah, yes, and it's kind of dancing around the should it happen on the streets, and we have an officer involved in a crash investigation. That's pretty straightforward. But when it happens in a parking lot, then what do we do? So that's kind of where we're. Yeah, kind of where we're playing around with it. But, no issues there, I guess. I don't know, you have to make a motion to table, or you can just table. I'm not sure. I'll look it up in Robert's rules. We'll defer action to next one.
We'll just defer it until next month.
Sounds good.
All right. Other business. I don't think we have anything unless someone comes up with something. All right. Motion to adjourn.
I'll make a motion to adjourn.
All right. Second.
I'll second.
All right. All in favor of adjournment, say aye.
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 All right. Any opposed? Okay, we're adjourned.
Thanks, everybody.